You're on mute, Alice.
Good afternoon and welcome to this week's Independent Sage briefing. There's an enormous amount to discuss as always, but we'll start as usual with the facts and figures, and after that we'll be going to questions from our special guests, press and members of the public. We've got a particular focus today on children with special needs in this time of coronavirus. And this week, joining our regular panel, which of course includes some of the country's leading virologists, epidemiologists and public health experts, we're joined by a guest expert, Professor Paul Greengrass. He's a paediatrician and a specialist in sleep and neurodisability at the Evelina London Children's Hospital. He'll be taking questions from families of children with special needs. But first of all, as is our tradition, Professor Christina Pagel will start by presenting the week's figures. Christina, over to you.
Hi, everyone. I hope you can see my screen. So the latest numbers on COVID this week, mostly bad, is the summary. And what I'm going to go through today is looking at the growth of cases, hospitalizations and deaths. And then Public Health England released their weekly report yesterday, but they actually had some really interesting stuff about what we know about how and where it's spreading. So I want to do a little bit on that and then think about how can we reverse growth. And I'll be looking at what some other countries are doing and what we can learn from that. So this is the number of new confirmed COVID cases by reported date, people who've had a positive test. You can see this has been going up steadily, well over 20,000 a day for the last week or so. The Office of National Statistics released its infection survey today. We're showing a very similar thing, again, a big increase from last week to this week. The Imperial REACT study, which tests 150,000 people every 4 weeks, released its interim results yesterday, also showing a big increase. So I think there is no doubt that COVID is continuing to spread. This is now looking at the different nations. And what I've done this time is kind of looked at when different measures came in. So this is England. So mid-September, there was the rule of 6. And in the north, they started putting in extra restrictions like bans on household mixing, some extra restrictions on pubs. And then 21st of September is when SAGE recommended a circuit breaker, but instead what we got was the 10 p.m. curfew on pubs and restaurants, some additional restrictions on mask wearing, and a work from home advisory. That became the tier system in mid-October. But looking at cases in England, really, it doesn't seem to have had much effect. There may be a slight slowing now with the tier system. And as we'll see later, that seems to be tiers 2 and 3, and definitely not tier 1 that's creating any slowdown. Scotland instituted some stronger restrictions in its central belt, where it shut pubs and restaurants. And it always takes at least a week before you see any impact of a new policy on cases, because that's how long it takes someone from infection to getting symptoms and test. And after about a week, you do see here that Scotland is now flattening off. So what that seems to suggest is that intervention has been enough to reduce R, but not enough to actually bring it below 1 and reduce cases. Northern Ireland had a pretty terrible end of September and beginning of October with a really steep increase in cases. They instituted a circuit breaker, a 4-week circuit breaker 2 weeks ago. And 2 weeks of that included schools, which are now going to reopen, but everything else stays shut. And again, for the first week, there was a slowdown, but then the last week it has started to come down. So it looks like this circuit breaker is now starting to take effect in Northern Ireland. Wales instituted its circuit breaker last Friday and have seen a steep rise this week. Again, we wouldn't expect to see any impact of this until next week, but it certainly shows that Wales didn't do this a moment too soon. Really, you wouldn't have wanted them to wait another week before doing this fire break. Going a bit further into the English regions, same picture as ever, except the y-axis keeps getting taller. more cases in the north. Now, this only goes up to the 23rd of October because the regional cases are lagged. This also matches pretty exactly the ONS infection survey released today, that also goes up to 23rd of October. And the good thing about that is it's showing that it looks like people who need a test can get a test, because we're not seeing any skew from any kind of weird testing situation. So what we're seeing in ONS is matching pretty much exactly what we see in the cases. And I'm just going to take off the top two, the Northwest and the Northeast, just to show you quite how steep this increase is in the rest of the country. So all of these areas are in tier 1 and have been in tier 1 effectively since about the 18th of September. And since then, they've pretty much increased sevenfold. London went into tier 2 around here. And again, we wouldn't expect to see anything until next week, because it takes at least a week to have an impact. So it's certainly not the case that these places are okay. It's not under control here at all. This is new hospital admissions with COVID per day in England. And I've now taken this all the way back to March, because hospital admissions is one of the indicators that actually is reasonably comparable between the first wave and now. And really what you can see, apart from the fact that this was a really rapid increase compared to now, is that we're now at about 1,200 admissions a day. That's higher than we were on lockdown day, but it's also just over a doubling away from April peak, which was 3,000 admissions a day. And we've seen pretty consistently in cases, hospital admissions and deaths, we've seen 2-week doubling since beginning of September. That may be slowing down a little bit, but really it does mean we're probably 3 weeks away from the April peak in hospitalizations. And that is a problem. And what you also have to remember is, you know, the hospital admissions for the next 2 weeks are pretty much locked in. We can't change them because people will already have COVID who will need hospital in the next 2 weeks. And so there's no doubt that within the next 2 weeks, hospitals will be struggling, particularly in the north of England. So again, this is looking at number of new admissions per million people per day across the different regions. And you can see that it's increasing everywhere. It's still increasing in the north. And this 40 per day per million is about where London was on lockdown day. And the Northeast Yorkshire and the Northwest are all now above that. And we are seeing that hospitals there are having to start cancelling electives. And they've opened the Nightingale Northwest. And so, I mean, I think the situation there over the next 2 weeks is unfortunately only going to get worse. Looking at deaths, this is from Office of National Statistics, so deaths that have COVID on the death certificate, which is kind of the gold standard, but it's always 2 weeks out of date. But again, we've seen a steady increase. The doubling in deaths every 2 weeks continues. For the first time, we're really seeing a kind of significant new number of deaths from Scotland. If we look at daily deaths in England, just because it's a little bit more recent data going up to yesterday, again, you see these really just relentless 2-week doubling from early September onwards. And in the last 2 weeks, we've had, you know, over 2,100 deaths in England. And deaths over the next 4 weeks, unfortunately, are kind of, there's not much we can do to stop them because people already have COVID. And that means that, you know, we are looking at the next 2 weeks, maybe 4,000 people, and 2 weeks after that, maybe 8,000. And I just want to note here that on the 21st of September is when SAGE suggested we have a circuit breaker. And that wouldn't have prevented deaths over the next 4 weeks, but it definitely would have prevented many of the deaths we've seen over the last 2 weeks. And it definitely would have prevented many of the deaths we'll see over the next 2 to 4 weeks. And if we want to prevent more deaths in 6 weeks' time, we really have to reverse growth now, like now. So what can we do to do that? So this is where the Public Health England report is really helpful to understand about current spread. So this is just looking at cases in different age groups in different regions. And the key thing is here, these spikes in the Midlands and Northeast and Northwest, the Southwest, are basically younger people, 10 to 19 and 20 to 29, and they basically had a big surge and now it's coming down. But the other age groups, the older age groups, are all going up, which is a problem because that does lead to more hospital admissions and more deaths. And the question is, now that it has spread to the older age groups, will it keep spreading or will they start coming down too? And we just don't know the answer to that yet. And this pattern is exactly what the Imperial React study found as well. But then what Public Health England did is they dug into these young groups a bit more and did it by school year. And what you can see here is that this spike is almost entirely college and university age students. And that actually school children, whether it's primary or secondary, and even nursery school age children, are all going up. And so this seems to be a real kind of university-driven spike here. And I think it does mean that we have to think very carefully about what we do in universities in January. They also then looked at secondary school age children in particular. And you can just see here, this is the beginning of term in September, and this is the beginning of half term in England. And you can see cases have been increasing a lot. We're not saying, and we don't know these children caught COVID at school, but it's certainly true that as COVID is more prevalent in their communities, then children will be going to school with COVID, and it becomes an area where you can carry on spreading it. So I think the schools are going to be an issue if you want to bring R down below 1. And this basically is from ONS showing pretty much exactly the same picture. So last week there was this weird thing where secondary school children seem to go down. That is no longer the case. They're also showing a sharp increase in secondary school age children. And just one more thing from the Public Health England report. This is when on Test and Trace, when they contact a person with a new positive test, they say, what have you been doing? And the top thing that people have been doing is going to the supermarket. But after that, it's the pub, restaurant, school. So it does seem that pubs and restaurants and schools are among the most common locations. And so that's we're kind of back at this, do we restrict pubs and restaurants or do we restrict schools kind of question? And it is a trade-off. So the whole of Europe is basically now trying to find the magic formula for how you get R below 1 without having too strict restrictions. And they're all trying different things. And we can now start to look at what have they done and has it worked? So I'm just looking at the Netherlands here, who've had a pretty awful September and October. And they actually tried things that are very similar to what England has done. So they started in regions, asking bars and restaurants to close 1 hour earlier and restricting a bit of household mixing. Then they kept extending it to more regions. Then they made it national at the end of September, but none of that really slowed growth. And then 2 weeks ago, they actually closed bars and restaurants across the whole country and further restricted household mixing. And a week into that, you can maybe see it starting to slow growth, but this does not seem to be enough to bring R below 1. And this, I think, is actually quite similar to our approach. So I think this should make us a little worried. This is the French situation, which is actually very similar. They too tried a regional approach where they closed bars and restaurants in one city and then another city and then more places and then even more places. And basically what you're seeing is that as long as it's growing in other regions, it will keep growing. And so now France have instituted a kind of a national lockdown, which closes everything. It's really harsh, except they're keeping schools open. So looking at what happens there over the next 2 weeks is going to be really crucial in kind of thinking about our policies on schools. And just kind of quickly on Ireland, who again have tried the regional closure thing with their 5 levels. This is level 2 everywhere except Dublin and Donegal. So level 2 is effectively like our tier 1. And then they moved into tier 3 at the beginning of October, which is when I think the science advisory group actually recommended level 5. And that effectively is kind of a mix between tier 2 and tier 3 here. And cases still carried on rising. It looks like they might have started leveling off a little bit. They instituted level 4 in some places, and now they've gone into level 5, which is kind of their strictest thing, which is effectively similar to France. Very strict restrictions, but schools are open. And now cases in Ireland are coming down, and we'll have to see what happens over the next few weeks. So what can we do? We need to reduce cases really rapidly. We need to get R below 1. If we can get it to 0.6, which is kind of total lockdown, including schools being closed, then cases will halve about every week. But we have now missed half term. We've missed that opportunity. So anything we do now would mean closing schools in term time if you went down that route. From what SAGE estimates of the impact, it looks as if we close everything and left schools open, you might get R to 0.85 roughly. And then you'll have cases halving about every 3 weeks. So it takes longer. And instead of kind of doing it in terms of how long you should do this for, we're thinking you need to aim to get cases below 5,000 a day. And that should be enough to allow test and trace to be able to cope. We have to reform it so that it definitely can cope, but that's kind of what we're aiming for, is to get back down to below 5,000 cases a day, which is kind of where we were beginning of September. And this is just kind of showing you different ways of doing it from cases. So you could do it with a hard lockdown, you'd get there pretty quickly, but that would mean shutting a lot, including schools for 3 weeks, which is obviously very disruptive. You could do it over about 8 to 9 weeks, keeping schools open, which would kind of take you to Christmas. But again, that's a really long time of disrupting business and people's lives. Or you could just try and get R to just below 1, which is effectively kind of a tier 3 plus everywhere in the country. But that would take a really long time. And actually it comes at a cost. That this kind of difference is a lot of extra cases. So you're looking at almost 1 million extra people getting COVID over the next 4 months if you choose the slow route compared to this fast route. So it's not, it is kind of a trade-off for how you want to get R below 1, but the absolute priority is that we do have to start reducing cases. So just to summarize, COVID is continuing to spread across Wales and England. Scotland is levelling off, Northern Ireland is coming down, and Wales should see its impact from its 5 break next week. We should see cases start to come down next week. We are just one doubling away from reaching peak of hospital admissions in England that we saw in April. And that's about 17 to 20 days from now. So the government, again, this is still true, urgently needs to halt and reverse growth. And there's trade-offs between the severity of a circuit break and how long it has to be. And keeping schools open does require more restrictions for longer. And then, the better tests and traces, the fewer restrictions we need once cases are below 5,000. And that supporting people to isolate is absolutely crucial in improving test and trace. And that is the end of my presentation.
Christina, thank you very much. Please can I remind everybody at this point to mute their microphones when they're not actually talking. And now I'm handing over to Professor Deenan Pillay, who's going to talk briefly about Independent SAGE's recommendations for test and trace. Deenan.
Thanks, Alice and Christina. Just a couple of more minutes before questions, and focusing here on what we're aiming for in terms of test and trace. And I'm fortunate to have some slides from Carl Friston, our modelling expert within Independent SAGE, who can't be with us, but to lead us through this discussion. So in essence, what we're aiming for is a circuit breaker, something that will deal with these increasing infections that Christina has just talked about. But of course, we do need that test and trace, contact tracing being as effective as possible in order that when we do start to bring infections down, we can keep them down. And so the aim requires 2 things. First of all, the prevalence of infection has to be sufficiently low to ensure that the test and trace can work optimally. Christina has just talked about coming down to 5,000 cases. At the graph at the bottom of this slide, the windows of opportunity as we've came out of the lockdown earlier on this year, which is identified on the left-hand side of that graph, we feel was probably wasted. The test and trace was not formed to a level which could deal with and the number of infections, and we're now suffering that with the second wave, and we will have another opportunity. And the key thing is for us to develop test and trace which can deal with that for the future. So in other words, when we come down to 5,000 cases per day, we're able to really keep these levels low. The next slide then says, well, how effective must that contact tracing be to achieve our goals? And here at the bottom, we identify what we call an efficacy. In other words, how effective can that test and trace be? And it doesn't need to be 100% effective. What we feel is that just 25% of contacts of cases of COVID-19 in the country will, if we can manage that and effectively isolate those contacts for a period of 14 days, then we will be well on the way to controlling things at a very low level of infection. By contrast, at the moment, as I'll show in the next slide, we're actually only at about 3 to 4% of effectiveness of our contact tracing. And I want to show this through this, what we call this dashboard that has been recently, in fact, this week, launched by an academic consortium that some of us are involved with through UCL. And this gives us sort of what we call a waterfall, or a cascade of the different stages of the integrated process of test and trace. Of course, whatever the data that comes out and is presented, which are often data around specific components of this, one's got to look at the whole integrated test and trace public health program to look at the effectiveness. And we start on the left-hand side. These are for data from the 8th to the 14th of October, and this is bringing different data sets together. So of course, there's not an ideal alignment, but on the left-hand side, 100% reflects the estimated number of cases per day from the ONS survey. And then as we move to the right, we can estimate from these different data sets how effective we are at, first of all, testing those individuals, the 39% of symptomatics, how many of those individuals are reached. We get those data from test and trace. Proportion of those who are reached who provide contacts. Then under the isolate column of those, what number of close contacts are advised to isolate. And we see only 16% of contacts of cases are actually reached to ask to be isolated. But and then what proportion of those do actually isolate? Well, we don't have data that are collected routinely, but from the sort of research studies that have been done, we think that's only a maximum 20% of people asked to isolate actually do isolate, which brings us down to actually only something like 3 to 4% of individuals who are contacts of COVID-19 cases currently, this is in England, are actually isolating. And this is far, far too low to achieve our goals for the next stage. As we've said, this 4% here needs to be far higher up, and therefore all stages of this, what we call cascade, need to be increased. So the take-home message is we need to reduce the prevalence infection as quickly as possible through, we'd argue, a circuit breaker or a national lockdown. And as soon as cases fall below about 5,000 new positive tests a day, then by that time we need an effective test trace, find, test trace, isolate, and support program. Of course, we recognize that supporting those to isolate are critical. And I just want to highlight my last slide, our statement on the management of NHS test and trace that's launched again on our website today. We're not just a scientific advisory board, we also think deeply about how best we can implement our advice for the benefit of the population. And the summary is here, is that Clearly, the NHS test and trace as it stands is failing, the so-called NHS test and trace, because of course it's not embedded within the NHS. We have published a blueprint to guide comprehensive reform of this that's been discussed at previous press conferences. It requires a true integration between NHS laboratories, primary, secondary care, local directors of public health, local authorities, with, we argue, NHS oversight, so it's truly embedded. And of course, the huge budget that's gone into this, £10 billion, needs to be reallocated to support the development of these services within our existing structures. And so in the end, we further advise it's vital that a new find, test, trace, isolate and support structure is in place by the time current statutory restrictions and other social distancing measures are relaxed, in order that we can try and prevent further lockdowns of this sort. Thank you very much, Alice.
Thank you, Dean. And so now it's time to move on to taking some of your questions on the topic of children with special needs in particular, and the impact that coronavirus and restrictions have had on them and their families. Before we'll open up to more general questions from the press and public, but I've just got a couple of quick housekeeping notes before we take the first question, which is, if you're asking a question, please keep it short and please ask a single question. I know that our panel will keep their answers sharp, precise and concise. And please remember as well to mute your microphones when you're not actually speaking. So here we go then. The first question is from Kathy Wessel, who's founder of Autistic Girls Network.
Hello, I'm Kathy Wassell and I run Autistic Girls Network, which is an organisation campaigning for the better awareness of how autism presents differently in girls, because it's highly underdiagnosed in girls and the average age for diagnosis is much higher than in boys. We have over 5,000 members and many girls who've been missed, just like my own daughter, who was not diagnosed until she was 13 and suffering very serious mental health issues, and indeed 2 years out of school as a consequence. There was already a special needs health emergency in terms of mental health before the pandemic, with literally thousands of children around the country, just like my daughter, who have been unable to go to school because of anxiety or unmet sensory or cognitive needs, and have been at home without a placement. Now that all young people have been affected, it seems to have been acknowledged that isolation is dangerous, though many of those children and young people can't get any help from CAMHS because they don't pass the care threshold, often unless they have actually attempted suicide. What do Independent Sage suggest to do for the thousands of SEN kids out of school before the pandemic and still at home or on a part-time timetable?
Thank you, Kathy. And I would like to go first to our guest paediatrician, Professor Paul Gringas. Paul.
Yeah, hi. So first of all, Kathy, thank you very much for that question. I entirely agree. It's often quite hard to diagnose girls with autism. The recognition is increasing, but it's precisely because it's more subtle that the huge levels of anxiety that lead to other mood disorders and often behaviors that can be quite challenging can be catastrophic. And as you've highlighted, unfortunately, the background baseline, even before COVID came, was not satisfactory. There have been times in history when community services have been coming together in really productive ways, but over recent years, a lot of posts are unfilled in particularly by the community paediatricians that are often the cog in the very complicated wheel that needs to pull together all the different services, the speech and language therapy, the psychology, and as you say, CAMHS. And so referrals get difficult. We, like you've said, I entirely agree that these have been magnified during COVID. We've had children unable to go to school, unable to have respite, unable to have short breaks. The very services that they were seeing have been completely have been redeployed. So just to point out, this isn't due to the professionals not wanting to help. They've been redeployed to other services. And I think what we're saying is what can we learn from what's happened? And were too many people redeployed without enough thought? And I actually think that children with autism, special needs, if we can get it right for this group of children, we will automatically be getting it right for typically developing children. So it's a huge challenge. It's vital, and we are certainly, and the Royal College of Paediatricians is saying we should not be redeploying paediatric services without really careful consideration, because for a lot of these children, we can do more harm than the harm that COVID would do. So that's a kind of a medium brief answer to a really complex question. Thank you.
Thank you very much, Paul. I'm going to move straight on to the next question, which is coming from Elle Hamilton. He's a parent from East Lothian. Elle.
Hi there. Can you see me?
We can just see your name, but we can hear you.
Right. My question is on autism, but it's slightly different. During the lockdown, my daughter actually was at her best. She had zero meltdowns. She didn't have to deal with people. It was just me and her in the house. And frankly, she's never been better. I shielded throughout because I have severe asthma. But when my daughter went back to school, her behavioural problems have started to accelerate again, because as soon as they mention COVID in the classroom, that's it. She masks all day and very much keeps it in. But as soon as she gets home, then her behaviour obviously changes. So my biggest problem is, because she's so anxious of my health conditions, she's shaking, she's not sleeping properly, and her behaviour can be quite challenging at times. And I was just wondering if you had any advice on that.
Paul, can I come to you again first?
So thank you for sharing that, Ellen. And again, it might not be much consolation, but we've actually seen exactly the same thing. So whereas a lot of children's behavior, health and sleep have deteriorated, for those children where there were a lot of school-related anxieties, we've actually seen some improvements. And some children with sleep problems, they've been able to free run, and actually parents have been busy with work and stuff, and so their sleep's fitted in a rhythm that suited them, and their worries have decreased. The whole thing about shielding is a huge issue. It's not just the children getting concerned when a parent like you has to shield, but also children that we've shielded. And I think the only thing that is probably reasonable to say is we probably we overdid it. So some of the degree of shielding we thought we needed first time round hasn't been proven this time round, and we have seen that again, and the impact it's had on families. We've had people who've had to give up their jobs to look after one member of the family that's shielding. So I think it's really got to be carefully balanced. The benefits obviously to protect you, but to ask the question, do we really need to do this as well? And I think gradually this time around, guidelines are changing. Everyone's kind of nervous about it, but I think we've always got to ask, might we be doing more harm than good? But thank you.
Thank you, Paul. And Dr. Zubaida Haque, I know that you'd like to comment on this as well.
Yes, please. I mean, I think breaking issue at the moment, and we know that mental health overall is a growing concern. It's going to be catastrophic, really, as this pandemic goes on. But children have been the invisible group in this pandemic, and I think when it comes to children's mental health generally, it's also been invisibilized. It's been greatly ignored. And one of the groups of children that I'm really concerned about, as well as SEN children, as well as children with autism, are also children who are losing their loved ones left, right, and centre. We know that children in deprived areas, we know children from Black and ethnic minority groups are much more likely to be losing their loved ones. And there's no conversation about that among government ministers about how how we can address the mental health needs of children. And I do think it needs to be prioritised, and I do think more resources need to be put into that.
Thank you, Zubaida. And I know Anthony Costello would like to answer this as well.
Just very quickly, I mean, autism, as we know, is a huge spectrum from extremely severe at one end to what's called relatively mild at the other. And I know I've got friends who've got children at that end of the spectrum, and it does cause intense anxiety. Just a question, really, both to Ellen and to Paul. Does, getting out, rather than going into the kind of anxiety-making environment of a school, do walks in parks, in open air, in nature, dealing with pets, things like that, which are anxiolytic to other people, do you think that is an important option, and one that, if there's any lockdown, we should make exceptions for children on the autistic spectrum?
Ellen, would you like to reply to that? If you're still there. Or Paul, would you like to comment?
Yeah, no, I'd certainly like to comment. I think the first thing to say is it's easy to underestimate just how fearful and anxious some of these children are. And parents, with the best will in the world, have said, we need to get outside. And the child, we've had children who restrict the whole family because they are so terrified of going outside. And we've had to do very gradual baby step exposure, just get to the front of the garden step and then go back. So I don't think for a lot of these young people, it's been the constraints around the guidelines. It's actually been their own fears, and I'm not sure that the message about the relative risks when you are outside has been communicated as well as it maybe could to those groups.
Thank you very much, Paul. Right, moving on to the next question. It's coming from Mark Eccleston, who's a journalist, filmmaker, and a parent of a child with special needs. Mark.
Hello. First of all, thank you very much for everything you do, by the way, guys. I think it's very impressive, and keep doing it. I have 3 kids, teenagers, 2, 14, and I also have an older boy who's 15 who has autism. And I guess we've been very cautious before schools have opened up for them and tried to explain the risks involved in this whole pandemic. But ultimately, now the schools have opened up, we don't have a choice but to send them there. We can't afford the fines, and we can't afford to lose places for all of them. So my question is this, having these 3 kids who say to me they don't think it's safe to go to school, and I'm not wanting to lie to them, what do I tell them when I actually believe that it is not safe to go to school?
Paul, would you be able to answer that?
Yeah, I can have a go, and I'd invite the rest of the panel as well. I mean, yeah, again, Mark, your children are kind of obviously sensibly looking at what's going on around them and responding to the news and the messages, but I think the benefits of school to them are absolutely huge. It's really kind of not measurable, and I'd be incredibly fearful of schools closing. I think schools have done an unbelievable job. And a quick note here, I think that all the funding for schools to make COVID adjustments stopped in July, and yet schools are telling us that every single day they're doing extra things to funnel children to different sections and to keep it clean. That is crazy. At least fund the schools to be able to do that. But and my experience from one of my children as well, the schools are doing a great job, and they're managing it in bubbles. I think the risk is really well managed, and so I think it's balancing. It's obviously crediting them with a really good question and a reasonable thing to concern about, but most schools around the world have managed to successfully open, and I think should stay open. Mark, did you mean that they're worried about the risks of COVID to themselves, or giving it to you or other family members?
Yes, I mean, we share some underlying health conditions with your previous questioner, Ellen. So they are concerned in bringing it home. And I do understand when you're talking about balance, but I should say that although I think the school that they're going to locally is absolutely brilliant, I don't accept the way that they've contain things within bubbles on paper, which seem to be year groups, but on the 5 cases that they've already had in one year group, they pressed on, but only asked about 6 to 10 children to go home based on a geographical idea of where they sat in the classroom and some additional questions. I do want them to go to school. This is the other part of this that really upsets me. And I'm not saying that you're suggesting it, but when you hear parents say, come on, you kids love school, it's great for them, it's where they should be, I absolutely agree. You're sending them to a school that has presented you this idea that there is a year group bubble of 120 kids, and after one case, it's still not being shut down in that principal idea of a bubble, and continues to just be piecemeal until eventually they decide to shut it down. It does make me feel slightly, well, it's slightly worried, to say the least, and ultimately.
Oh, Mark, we've lost you there, I'm afraid. I hope you can still hear, because I'd like to invite Susan Mickey to comment on your original question as well. Susan.
Thank you, and thank you for that question, Mark. I think the first thing is always to be honest with children in communication, as one's honest with everyone. And the second thing is, I think this is a conversation that needs to be had across the whole population, including children, which is how to assess and manage risk. And I think that it's not been a conversation that's had sufficiently, because the emphasis has been on rules. You know, this is what you need to do at this point in time. You know, do kind of keep your hands clean. Don't meet with people from other households. This changes and often quite difficult for people to keep up with. But I think for people to begin to think about the complexity of different types of risks, of doing different things, of going to school versus not going to school, and the risk in terms of physical health, in terms of mental health, in terms of educational and social progress, and therefore thinking about the future, not just today. These are complicated, but I think we need to find language and ways of discussing this with children, yes, but also with adults.
Thank you very much, Susan. Moving on to our next question then, which is from Helen Brown from the West Midlands, and she's the mother of 4 children, 2 of whom have tracheostomies. Helen. Are you there, Helen, to ask your question? Right, we might come back to Helen Brown. I will move on to the next question, which is from Lucy Douglas, who's the mother of an 8-year-old who's having difficulty sleeping. And I'm going to read out her question. She says, how do you get out of the cycle of COVID making anxiety worse, which causes more sleep disturbance, which in turn makes behaviour worse and anxiety worse, which causes sleep to be more elusive? Which part should be tackled first? I think, Paul, I'm going to come to you as our guest paediatrician once again. What advice would you have there?
Yeah, and this is something that I come across kind of all the time. We run a very big sleep clinic for children with quite severe sleep disorders, but we also are very well aware of the beautifully described this vicious cycle of I'm anxious, those anxieties get worse at night when I'm trying to fall asleep, it's hard to fall asleep. And then the next day it gets magnified because you might start worrying even during the daytime about how am I going to fall asleep that night. So on the SAGE website, there's a question and answer, and there's a link there to a sleep resource that our psychologists put together during COVID that I think is really, really helpful. And it has also some suggestions about anxiety using quite kind of simple breathing and mindfulness strategies that all need to be combined and obviously delivered with sympathy that this is hard for everyone. So a lot of people are having difficulties sleeping, and very much it also speaks to the importance of light in the morning, exposure to the outside world. But so I would, rather than me reiterating that now, I would that's a free download. There's a lot of resources out of there, but that's one, and it's a good place to start with, and it's been helpful for many families like you.
Zubaida, I know that you were saying something about, or you were messaging about managing risk and involving children with that conversation. So would you like to comment at this point? We can't hear you.
Sorry, just a quick one, really. I was just supporting what Susan was saying. I thought sort of Susan understated it, but it's a very powerful point that, you know, you can, although the risks externally don't change, you know, in terms of COVID-19 risk out there, the knowledge, especially for children, especially for people who are anxious, that they have some control over the risk in terms of managing the risk, as Susan rightly pointed out, the washing hands, contact with people, and so on, the social distancing, all of that, and re-emphasizing that will make a huge difference. And I think the point that was made earlier, that perhaps the government haven't targeted children enough with getting those public information messages across, is also an important one.
Susan, have you got a brief comment there?
Just to quickly add, I think it's not either or. I think that with anxiety, one of the key things is to keep communication going, ensure that children feel able to raise their anxieties, that they always have somebody to listen to, they can discuss it with. And with sleep, I think one of the really important things is to have a routine, a structured routine that's the same every evening. And again, that comes down to the control, the predictability that tends to reduce anxiety. So I would suggest ensuring that one's thinking about both those things simultaneously.
Anthony, I think you had a brief comment to make as well.
Well, yeah, Paul's the expert, but my tips about sleeping, and Susan's right, a routine is very much about no stimulants after 5, 6 in the evening, like tea or coffee. Don't take your telephone to bed. That's been a big problem for me because of all the Indie Sage people sending me messages at all hours of the day and night. But also this physical activity thing, there have been randomized controlled trials of yoga. I use yoga a bit when I'm insomniac. And if you do, 10 minutes of relaxation and doing stretching and stuff, I find going back to sleep. And there have been some studies with children on that, I think. So the physical element of it, as well as the mindfulness element of it, I think is important. But Paul will probably know the literature better than me.
Yeah, so let me just talk it'll just for 2 seconds. When it comes to exercise and children and sleep, children are inherently much fitter than us, and a quick walk or 10 minutes of yoga doesn't seem to cut it. And a lovely study put children on exercise bikes, and it was actually only the ones who were pushing themselves to kind of 75% of maximal heart rate. So the ones who were red in the face and sweating and breathing hard, that actually had an impact on the amount of restorative slow wave sleep they had at night. So it actually translated, and they did formal sleep studies. You don't want to do it too close to bedtime. But so what I would say is a gentle walk in the park is not as good as getting out of breath. And it doesn't matter what you do, whether that's a trampoline for some of the children we see with autistic spectrum disorders, or taking the dog for a walk and racing the dog. But yeah, I mean, so it's a very good point. That's all on the sleep tip sheets as well that you can download.
Thank you very much, Paul. Next, we're moving on to some more general questions from members of the public and the press. And I'm going to read out this one from Ashley Cowburn, who's the political correspondent for The Independent. And his question is, on the government's 500,000 testing capacity target by end of October, on 460,000 now, do you think it's a meaningful target? Does it matter that capacity is so much more than actual testing? And do you think the figures are being massaged? Who would like to start with that one? Gabriel Scally.
Well, it's an interesting question, and I read the latest version of the Moonshot with interest. And there is a real problem with the government thinking that, and they took it very literally. This the Director General of WHO early in the pandemic said test, 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 and he didn't really mean just creating tests in abstract laboratories and not applying them. It was actually part of an organized program where you find people and you help them get tested, and then you do the tracing and the isolation and the support. And the government seems to have forgotten all of that. And they seem to be regarding testing capacity and tests as something like fairy dust that we're going to sprinkle liberally over the country and it's going to make the virus disappear. It ain't like that. And this is not going to work unless it's within a really organized system. And again, one of the recurrent themes is the absence of a strategy or a plan. And we get these sporadic, great ideas launched by the Prime Minister or some of his acolytes. And they are meaningless. They are distractions, and they're an attempt to get headlines, and they're a distraction from doing what they need to do, which is get a strategy and a plan in place, and one that is workable and will help us deal with the virus. Because the evidence, as presented at the beginning of this, is that we're not dealing with this virus. We're failing badly. And no matter how many tests the government produces, it's not going to work unless there's a really good, soundly based strategy, and that is what is missing.
Dean, I wondered if you'd like to comment on this one.
Well, just to add to Gabriel's very pertinent points, I thought we'd come to the end of this sort of boosterism, you know, of talking up individual things after Moonshot sort of the idea failed so completely. But here it is again, it is one component, as Gabriel says, of that cascade, of that waterfall, of that integrated system that I showed earlier on in my talk. I just say one more thing, you know. This is a capacity. Why talk about a capacity for something? I mean, either we're testing people and we're doing X number of tests, or we're not. But the capacity is also, I think, a sleight of hand, really, when it comes to talking up the response. I'd far rather the government were able to say, you know, we're achieving our targets in terms of the number of people isolated who are contacts of the cases of X proportion of cases in the country. But when, you know, a capacity for testing doesn't speak at all to that public health outcome we wish for.
Anthony Costello, what about these targets for testing capacity then?
Well, look, we've had a positive message from both Christina and Dean saying if we can rapidly get cases down to 5,000 per day or lower, we can really move in with a reformed find, test, trace and isolate. We've been saying this for 6 months. Yet today I see no evidence of any change to the Lighthouse Labs quality control and management. I see no change to the Serco-CITL contact tracing, which we know has failed. We're seeing only small and inadequate investment in public health tracing, which we know can be very successful with very high rates. No consultation with GPs and primary care, inadequate financial support for isolation. And I haven't heard any real good comments on the find, test, trace strategy from SAGE, from the Chief Scientific Officer, the Chief Medical Officer, or Public Health England. And now today we're reading articles from George Monbiot and Twitter from Jolyon Morton, the lawyer, about VIP contracts, money given to cronies. And, you know, the whole thing is actually a growing scandal. I'm saying this individually, not on behalf of my colleagues here, but we need to think about it, because even if we have a circuit breaker, ultimately we have to reform this system. And I see no sign that that's happening.
Thank you, Anthony. Ashley Cowan, I hope that answered your question. We're moving on now to another question from the press. Alexandra Thompson from Yahoo. Alexandra, are you there?
Yes, hello everybody, thank you. I'm sorry to talk about Christmas, but I think it's important. If you get everything that you were suggesting, what can we realistically expect this Christmas with everything that you want going ahead? I mean, I live in London, I have family in the Lake District. Is that going to be possible? Also, I know you've really stressed that time is of the essence, these changes need to happen now, but is there kind of a cut-off point? We're a few days away from November. Is it by mid-November we have to see changes, and Christmas is out the question if not? Can you give any sort of suggestion to that?
What's Christmas going to be like this year, Christina?
So just to answer the second point first, having severe restrictions, like going back to a kind of lockdown situation, is always going to work. But the longer you leave it and the higher you start from, the more you're going to have to wait for cases to come down to below 5,000. and the fewer options you have. So, you know, it's always better to do it now, but there's never a point at which it won't work. In terms of Christmas, this isn't so much an answer to your question, except to say that it is going to be extremely challenging, and we really have to get cases down as low as possible if we want to have even a semblance of a normal holiday period. I mean, if you just think about it, if universities was 2 million students going around the country, this is millions of families going around the country, multi-generations, inside for, you know, a whole day with alcohol, and then everyone goes home, and a week later they meet different people for New Year, and then a week after that people go back to school, university, work. I mean, that's kind of 3 super spreading situations that we're potentially setting ourselves up for. And if we go into that with a high number of cases, then that just could be disastrous. So we just have to get cases down as low as possible, and the sooner we start, the better chance we'll have of doing it.
Does anybody else on the panel want to start thinking about Christmas this early? No, apparently not. So I hope that answers your question, Alex. I'm moving on now to a question from another parent, Janine Mitchell in Lancashire. Janine. Are you there, Janine? If she's not there, I'm going to move straight on to Daniel McKay from Renfrewshire. Daniel, are you there?
Yes. Hi, everyone. Thank you for this opportunity to ask questions and for all the work that you're doing at the moment. My question is more general, and it's about the new 5-tier system in Scotland. And I was wondering, given that the 3-tier system in England has received quite a bit of criticism around not going far enough to lower the spread of the virus, and Wales and Northern Ireland are in circuit breaker lockdowns, do you think that the new 5-tier system in Scotland will be enough to slow the spread? And do you think, for example, that people may find these 5 tiers confusing and difficult to follow as a result?
Gabriel, would you like to comment on that, this new 5-tier system?
Well, I haven't, I must admit, not to having looked at it closely, but I have watched the evolution of the notion of the tiers, and it's been a mixed picture, really. But in general, I've been impressed with the way that Scotland has dealt with the pandemic, but also impressed that some of the remote communities, the islands and Highlands and Islands, have kept the numbers so low. And I think they are in an exceptional place where perhaps a one size doesn't fit all, and it's necessary to have different approaches in different parts of Scotland. But there is no doubt about it that, as Christina said very clearly in response to the last question, you know, the earlier you take firm action, the better the response is going to be, and the quicker the response is going to be. And I do worry that setting up a tier system, it can be sensitive and it can be reactive, but it can also lead to delay, I think. So I think it's finely balanced as to whether there should be tiers or not tiers. And that's really a matter for debate. But there's no doubt about it that if you don't get the reproduction rate down under 1, it doesn't matter what tier you're in, it's not going to work.
Thank you very much. Zubaida, you wanted to comment on that as well.
Well, just very quickly, I mean, generally speaking, at the moment, we have the worst of all worlds with a tier system. We have a tier system that's entirely local, when in fact we have coronavirus, as Christina has showed, coronavirus cases are spreading everywhere exponentially across the country. So it doesn't make sense to have local systems on a crisis-led basis. And we have economic packages that are based locally as well. Now, nationally, the situation is the same. Nationally, businesses and jobs are being affected everywhere. In tier 2, there is no real support for jobs and businesses. There's no support for bars. And I think in that sense, it is very, very confusing. Even with tier 3, gyms are open in some places, not open in others. The situation is such that we have a national public health crisis. We are in the second wave and we need a national package. France and Germany have done it, and I think we need to follow very quickly.
Thank you very much, Zubaida. I think Janine Mitchell is now back with us. Janine. Are you there, Janine? Maybe you'll manage to join us by the end. I'm going to squeeze in just a couple more questions. So the next one I'll take is from Anthony Fitzsimmons from London. Anthony. Are you there, Anthony?
Yes, I just turning on the sound. Thank you very much for letting me ask the question. As we've heard, many students have had COVID and they're coming home as reading weekends or, they're coming home for reading weekends and they'll be coming home for Christmas. And as regards those who've had and recovered from COVID, what I'm wondering is whether they should be regarded as unlikely transmitters of the disease and therefore particularly safe to meet, even if you're an older person such as myself. And also, if there is an answer to that question, how does long COVID fit into the picture? Is that recovery or is that not really recovery?
Who would like to start with Anthony's question? Christina.
Just so, okay, I'm not an expert on this, but this is my two concerns. The first one is that although it's probably true that someone who has definitely had COVID and is 3-4 weeks out could meet people quite safely, the worry is that if you start doing that, then what you're actually doing is encouraging people to go get COVID so that they can then access those freedoms, which I just think probably isn't what we want to incentivize. It's partly because of long COVID. Just in terms of long COVID, I think my understanding is that although the symptoms can last for a very long time and are very debilitating, you're not actually infectious after the first few weeks, but maybe Dina knows more about that than me.
Dina.
Thanks for that question. I mean, it's a question everyone's asking because we want to find a way of in a way getting out of the strict regulations there are and shielding, particularly across generations. With regard to immunity and how long that lasts and so on. I think the jury is still out, to be honest. Just this last week, we've had two conflicting studies. One, the REACT study, which has multiple cross-sectional assessments in the UK showing that antibody decline over a relatively short period of time. And we've had papers from the States of following individuals who've had COVID, saying that those antibodies stay, for some months. So it's really very unclear at this moment in time. But the second thing is whether those antibodies actually mean that you can't be infected again. Yes, the data is sort of pointing in that way to support vaccines and so forth. But to start to implement that at a public health level and to say to the population, if you've had it or you think you've had it, you're safe to go and meet your parents or grandparents, I think would lead to mayhem and would lead to far more harm than good, because of course there will then be people who don't adhere to that. So I think it's one of the unfortunate consequences of trying to have a public health approach which actually prevents infection for all. But that would be my comment to your very important question. Thanks.
Thank you very much, Dina. I'm going to squeeze in one final question from Amanda Ferguson, freelance journalist. Amanda.
Thank you, Alice. I had some explanatory notes, but I'll follow your guidance and keep it short. Why do you think there's an apparent reluctance among some politicians on these islands to copy the homework of places that are doing better than us?
Excellent question. There seems to be better practice out there. Why aren't we following it? Gabriel.
Well, there are some politicians who are following good practice. And in fact, one of them has just retweeted one of Christina's slides from earlier on, and that's Nicola Sturgeon. And she and Scotland adopted a zero COVID approach, and which is great to see. I think it's a very interesting question. And I think there are a range of issues. Firstly, there is a background, I think, and Brexit has set a tone which is about this country, about the UK doing it for themselves. It is an isolationist approach, no doubt, that is behind it. And I noted very early on some of the papers emerging from SAGE very early on expressing a worry to government that if there were reports of successful preventive measures from elsewhere in the world that weren't being undertaken in the UK, it might cause public concern. And I think all of that has led them to be introverted, and sometimes with very strange manifestations, such as one of the press conferences where one of the officials said that testing really was only for low and middle income countries. So it is an isolationism, and it's a terrible pity, because when you look at the success of countries, particularly in Australasia, it is quite remarkable. Places like Taiwan and South Korea, Japan, as well as New Zealand and Australia. And there's no reason why these islands couldn't be the same as those countries, and some of them taking advantage of their island status. So it is a myopia, and it's been extremely damaging. I can't explain what the origins of this ophthalmological condition is, but it has had terrible consequences for us, the failure to learn from elsewhere.
Christina, you've scrutinised the figures in the UK. How do we compare, and how could we be learning from other countries' approaches?
Well, I mean, as Gabriel said, there's so many people to learn from. I think the whole of Europe seems to be struggling, so I feel like we're not the only ones who haven't learned. I kind of think maybe we rule things out too quickly because we think it's not possible here. So, for instance, in Southeast Asia, one of the things they do is they have much more restrictive isolation, and we haven't gone down that route, like kind of making sure that you actually do not leave your home, whether that's through an app monitoring you or people checking on your door every day. And that has worked really well, not just there, but also in places in South America and Central America. So, maybe we need to have a conversation, how much are we prepared to give up to have a more normal life? And it's not up to me to say, but I feel like we need that conversation instead of just not having it.
Anthony?
Well, I don't think it's quite true to say all of Europe has failed. I mean, if you look at Greece, Germany, Norway, Finland, they have way better figures than us. And if you go over to Asia, China, South Korea, Taiwan, they all have death rates more than 100 times lower than the UK. I think a big issue is the lack of a real understanding of public health by the government and by their advisors, that they haven't had a public health voice present at the table and still don't sufficiently, and are not addressing some of the very key basic things that we should do. There's been an element of British exceptionalism. And I think also we haven't had our fingers burnt in the past, to be fair, like, South Korea, Canada, Singapore, who'd all had the MERS experience of 2015 and the SARS experience from much earlier. So I think when the next pandemic strikes, I suspect that our response is going to be revamped and much quicker, but that depends on who's in power.
Thank you, Anthony. Susan, final response to that final question, please.
Yes, also it's worth looking at some of the poorer countries. So I've heard recently presentations from Kerala in India, Vietnam in Southeast Asia, Cuba and Uruguay in Latin America. And there are certain common themes there. One is daily briefings, talking directly to the people by public health experts and people who are really trusted. And that's one conclusion that's really drawn. But another one that we've referred to before is the importance of being local in terms of test, trace and isolate systems, embedding them in local communities and local public health structures. And what's the reason the government isn't doing that? I think one of them is that they are ideologically committed to private commercial contracts. So I think that's another layer of many explanations as to why we're getting it wrong. And another thing that actually distinguishes some of these countries is the ability of the government to actually be able to say, we got this wrong, and be honest and open about it. And I would suggest at this point, the government, on all the issues we've been talking about today, should look at the numbers, should look at what they've been doing, should look at the rest of the world and say, we've got some of these things wrong and it's not too late to change. We're going to do it now.
Thank you very much. Thank you for all of your questions. Thank you for all of those answers as well. It's time to wrap up for today, but first I'd like to invite Sir David King to sum up as usual. Sir David.
Thank you very much, Alice. I've just got two comments. One is an additional comment on that last question, which is obviously a very good one. I want to point out that there is another group of people in this country, basically coming from the business community, who are arguing very, very strongly against any form of lockdown, any form of restriction. They're saying, let it run, and our economy will recover. And I think that there is this false dichotomy between economic development and the health of the nation. Let's take all those examples my colleagues have mentioned of countries where they've got it under control, the death rate is small, and look at their economic output, and it's easily the least impacted by the whole pandemic compared with every other country in the world. I'm afraid we are in that small group of countries where the impact on the death rate and the impact on our economy is in that worst bracket. We're sitting there together. I just want to now add one more point. This group, the Indie Sage group, as we call ourselves, has now been meeting for almost 6 months. I think we've got a couple of days away from being in existence for 6 months. And none of us are celebrating in the sense that we didn't expect we would have to be giving advice and talking to the public openly in the way we are today for more than 3 months. We actually thought that our advice would be followed much, much more quickly. And here we are, repeating many points we've made over 6 months. For example, we've been saying that the summer was there to be used to get the pandemic fully under control with a new fully operative test and trace system, so that by the time we ran into the winter, we would be out of the pandemic. By the time we got to Christmas, we'd be well out of it. Instead, we've got this massive big second wave, no advance over where we were in the first wave. And it's just incredibly frustrating. I am, however, going to say I'm extraordinarily proud of this group of people who have been putting the case together, these independent SAGE. The group represents a group of world experts in the field in which they represent. They all have very, very tough jobs, day jobs, and the work they've put in to independent SAGE has just been quite remarkable. And don't forget, they're not paid a bean for all of this work. It's all a question of responsibility, public responsibility. So I'm going to take this opportunity to thank them all. Thank you.
Thank you, Sir David. Thank you to our fantastic panel. Thank you to our guest today, Paul Gringus. And thank you to everybody who's been watching, sending in your questions and listening online. All the reports that have been published by Independent SAGE are available on the website, along with details of the entire team. Do follow Indie SAGE on Twitter if you don't already. Next month, or next week rather, as Sir David mentioned, is our 6-month anniversary. And we will be back, same time, same place next Friday. Have a good weekend. Stay safe. Keep well.